The keys to unlocking a new non-invasive treatment for Parkinson's at Delray Medical Center. It's a type of ultrasound that gives Parkinson's patients lasting relief when medication no longer can alone. Two local doctors celebrating a major milestone and the first patient to undergo the treatment here. Join me to talk about it. Let's go on the record.
From WPBF 25, this is On the Record with Todd McDermott.
Good morning. The non-invasive Parkinson's treatment is called staged bilateral magnetic resonance guided focused ultrasound. It's the only time I'll say that. It's helping patients when their meds can't anymore. And we welcome neurologist Dr. Eric Dalvey, director of the Comprehensive Movement Disorders Center at Palm Beach Neuroscience Institute, to talk about this. It's so exciting, Doctor. Thanks for being here.
Thank you for having me.
I know that there are nearly 1 million people in America who deal with Parkinson's, and I know treatments continually come. Where does this focused ultrasound fit into all that right now?
So there's a range of patients who have had Parkinson's for 5 to 7 years, and they've tried treatments, medications, the most common being levodopa. But after a so-called honeymoon period, the medications start to fail. And while they were in an on state, their tremor is well controlled, they're able to walk comfortably, they're able to get out of a chair, their voice is strong. When they go into an off state, they might have trouble getting out of a chair or have poor balance while walking, or the tremor really comes back with a vengeance. They may also have involuntary movements called dyskinesias. So for these patients, no matter how you adjust the medications, their quality of life just keeps going downhill. And for that sort of patient, focused ultrasound can be a very good option, particularly in the new target that we have identified.
All right, well, we're going to dive deeper into this, but I think the first most obvious question is, do you see the tremors disappear as this procedure takes hold?
So the one thing about this procedure is that it is both quick in action and long in duration. So literally, within the course of the treatment, which is taking place in an MRI scanner over the course of something like 2 to 3 hours, we see the tremors start to get more and more mild and ultimately, in many cases, disappear altogether. But also relevant is that in the clinical trial that led to FDA approval of this procedure has been shown to have efficacy that lasted at least 12 months, and we're continuing to follow patients 2 years and beyond who continue to benefit from the procedure. Is
there a possibility, and I know that this is new, obviously, that as you go on, could this procedure be repeated if it needed?
Yes, but in general, our observations from this trial and a prior trial is many patients are able to maintain benefit, or at least significant benefit, for 5 to 7 years, which if you take a typical patient with Parkinson's in their 70s, by the time it starts to fade, they might be 77 or so. Repeating the procedure is technically more challenging than doing the first procedure, and we still don't have enough evidence on the best way of doing it.
I have to ask you what it's like to see a patient have their tremors stop while this is going on. How does that affect you? What is that like for the staff to see that?
So I've been involved with the field of surgical treatment of Parkinson's almost 30 years now, and even today the sensation continues to remain new. When you see a patient who's disabled from their tremor or other symptoms now suddenly become very functional, have that tremor go away, it's a moving experience.
I know that you're co-author of the study that was published in Lancet Neurology on this. People are reading about it around the world. Delray is now one of the centers for this type of research. What's the broader impact? Give us a sense of how the world of research into treatment for Parkinson's is reacting to what's happening.
Sure. So I should mention I'm the first author of the paper, and my colleague who you will interview, Dr. Zucker, he was the person in the clinical trial who performed the most procedures at Delray Medical Center. This procedure, unlike DBS, doesn't involve drilling a burr hole, putting a wire in the brain, putting a pacemaker in. It's an incision-less procedure. So it's a surgery without an incision. So it expands the options for patients tremendously, because a lot of patients might be too frail for DBS or may not want to go through an invasive procedure. So it opens up a whole new avenue for them.
I believe there's a pretty common misperception that tremors is the only symptom that these patients are dealing with? What else does Parkinson's bring to their lives?
So there's a good 20% of patients with Parkinson's who never ever have tremor. So their symptoms are slowness, difficulty with balance, muscle stiffness, and the like. And also, as I mentioned, around the 5 to 7 year mark, a lot of patients get these on-off fluctuations in response to medications and or involuntary movements called dyskinesias, which are just as disabling as the tremor. So this procedure really is helpful for that group of patients.
I'm fascinated to ask and to know what was the catalyst for using ultrasound in this way. Do you know what?
So the origins of ultrasound were more for tumors, especially, for example, uterine fibroids was one way that it was first applied. But what we found out was that we used to, before DBS came around, we used to do a procedure called pallidotomy that also involved drilling a borehole, putting a probe in the brain, and heating up an area of the brain that had the tremor cells. But this is a beautiful new way of doing it because we can do it without any incision or borehole. And also, we're able to monitor the MRI of the patient in real time as we're doing the procedure, which really adds to the safety of doing it.
And now, is there the potential that this could be used to treat Alzheimer's as well?
We are in the process of a research trial that is testing it for Alzheimer's. The methodology is different. In Alzheimer's, there's a bad protein, a misfolded protein called amyloid that accumulates that kills the brain's neurons. So what we are trying to do is open up the blood-brain barrier and allow the amyloid to be drained out, so that reduces the chances of progression of their Alzheimer's disease. So that is in very early clinical trials, again, at Delray Medical Center.
If it all goes well, when will we see more on that?
Research takes a long time. This trial involved about 7 years of effort. I should say 5 to 7 years will be the first that we can provide good data.
All right, Dr. Afdabi, thank you so much for joining us.
Thank you for having me, and congratulations on pronouncing the procedure correctly. That's quite a mouthful.
As I said, it's the only time I'm going to do it. Thank goodness for the teleprompter.
Thank you.
Still to come, we have the doctor from Delray also involved, who we spoke about, and the patient who had the treatment. That's when On the Record returns.
You're watching On the Record on WPBF 25.
Welcome back. As we welcome Dr. Lloyd Zucker, Chief of Neurosurgery at Delray Medical Center. Doctor, you're the co-author of that Lancet Neurology study that was published. This is such a big deal. Ultrasound, again, non-invasive treatment to treat Parkinson's. In simple terms, layman's terms, news anchor terms, can you give us an idea of what is happening when the ultrasound is in a targeted area of the brain? What's going on?
Well, actually, same ultrasound that you and I know, that we look at babies, we look at blood vessels. What this is doing is it's focused down to a point. 1,000 ultrasound sources that are focused down to a tiny spot. We know where that spot is because we see it on the MRI. We actually can watch that area of the brain heat, and what it does is it selectively destroys that tiny little area, and that's how the magic occurs.
That's incredible. If you could give us an idea of how you find out where to target in the brain. And again, we want to add, which Dr. Dalby mentioned, the brain is not being cut into in this case.
Totally non-invasive.
How do you find that target point?
Well, you know, the old saying, you stand on the shoulders of giants. We really know a lot about where these targets should be. There are studies that have been done prior to this. So what we do is we use that knowledge, but at the end of the day, the barometer is the patient, and watching the patient respond at a level that might not destroy the tissue but will cause a change gives us a hint that we are where we need to be. Once we have that in hand, we proceed.
Let's talk more about the patient, because we should stress here, the patient's awake.
Completely awake.
You're talking to the patient. What are you looking for from the patient while this is going on?
Everything. Obviously, the symptoms that they came in with, we can see the tremor, we can test their rigidity, check their speech, check their vision. They're basically told if there's anything that you feel that is even remotely abnormal, tingling, numbness, anything, We'd rather hear and know because, as I think Dr. Dalvey probably said, this very intricate area of the brain and a few millimeters one way or another truly does make a difference.
Now let's talk about the patients who this would be for. I mentioned at the top that really says something to do with medication. The doctor also mentioned medication eventually runs its course with many of these Parkinson's patients. So is this something that isn't done until the medication is no longer effective?
Probably the worst patient is the one that truly it's no longer effective in. You met Dr. Dalvey. I've been blessed to have a almost 15-year relationship now with him, a skilled neurologist that knows when to have the surgery. It's part of his toolbox. And so he almost calls it the honeymoon period. There's a patient that starts to have the medication become less effective. That's when he adds it in. That's when I see the patient 99% of the time. I agree with him. And that's the patient that we treat, and we almost roll things back for that patient to that period of time that they were responsive.
The beginnings of the meds.
Yeah, that's the whole trick.
And we talked a little bit about the time element here. It's a period of years that the meds are effective, and then the effectiveness wanes over time?
Usually, I mean, we talk about that honeymoon period being anywhere between 3 to 7 years. Some patients are more fortunate, I guess is the right word. But yeah, it does tend to change over time, and when it starts to change, you can intervene non-invasively.
We are stressing that again.
Oh,
There's
absolutely.
no cutting into the brain. What does this mean for Delray Medical Center to be at the forefront of this research and this success?
Excuse my smile. We are very proud as what really is looked at as a community hospital to do world-class research. Academic colleagues look at what we've done and the number of patients that we've done, and we are standing tall with major centers across, now with this study, across the world, quite honestly. And it's giving us further opportunities to take the science of focused ultrasound into other areas.
What a thrill that must be for your staff, for the folks at the hospital to know they're really providing hope and a future for patients all over the world.
I hope I'm not repeating Dr. Dalvey, but it never gets stale. It's just this remarkable feeling because you know you're actually modifying somebody's life. And at the end of the day, not to sound hokey, but that's kind of what I went into this for.
Sure. Makes perfect sense. What about the potential of using this kind of ultrasound to treat other neurological disorders?
And not just neurologic disorders. So we are looking into focused ultrasound for other aspects of neurologic disease, seizure. Dr. Dalvey may have mentioned Alzheimer's, but other kinds of ultrasound, what are called low frequency, can open something called the blood-brain barrier. So we talk about getting medicines into the brain that you couldn't. So all of a sudden chemotherapy and immunotherapy, treating metastatic cancers to the brain, treating primary cancers of the brain. The vista is huge.
I've got about 30 seconds for this segment before we meet the patient.
That's right.
But I gotta ask you, and I asked the doctor earlier, what was the moment like when you saw tremors stop?
Well, I think I probably can say I don't cry anymore, but it is just this gratifying moment because you truly know that you've done something that's going to make a difference and an impact, and hopefully when you get a chance to talk to the patient, you'll see.
What a gift to the
Truly.
world. Dr. Lloyd Zucker at Delray Medical Center, thank you so much.
Thank you so much for having us.
We're so glad that you came, and we have much more to talk about as we meet the patient. On the Record, we'll be right back. I am so happy to introduce you to Jan Holmstead, a Parkinson's patient who had the focused ultrasound procedure, as you can see, with great success. Thanks for being here. Your story is so important. But let's start at the beginning before this. No tremors, but what were tremors? What was the life like before this procedure for you?
I was super active after I retired in 2014 and always worked out, stayed healthy. So I had a pretty big shoulder surgery in 2022. And as I was recovering from that, I started feeling a minor tremor. I just thought it was something from the surgery, nerve endings firing up. And then after like 6 months later, I decided I'd let me go get it checked out. And then I was diagnosed with Parkinson's by Dr. Dalby.
I should add that you were a longtime Delray Beach firefighter with the department. That is an occupation where you're exposed to chemicals. It's part of the dangers of the job. Has that entered into your mindset as you've gone through this Parkinson's journey?
Oh, correct, yes. The firefighters has a 10 times higher risk of having Parkinson's than the average population.
At the worst of it, I heard the term, you called it the espresso.
Yeah, I basically felt like I had drank 50 cups of espresso. My internal tremor, I had external tremors, left face, side of my face, left arm and left leg, and they were pretty substantial, but my internal tremors was even worse. It was so exhausting, it was horrible.
Can you explain that internal tremor to us, because we may not fully
It's
grasp it?
basically like if you look at my arm tremoring, like when it did, like my whole inside of my body felt like it was never still, like it would always like jittery, and like I literally had 50 cups of espresso, like it was awful.
So what was the progression for you over that time, where it started to get worse and worse?
It was over a 3-year period where it got to the point that I wanted to look for another solution. And my daughter, Tiffany, she actually was a nurse working at Delray Medical Center with Dr. Zucker, and she had heard that they did this procedure, so she brought it to my attention, and that's when I went to see Dr. Zucker.
So your doctors bring up focused ultrasound.
Yeah.
Now, as you're describing what you're going through, I'm sure you were open to anything.
Correct.
When they said, we're going to hit your brain with sound waves, what goes through your mind? What do you think when you hear that?
I was excited. It was more like, I mean, some people were scared, like my family was scared, and I was kind of like, listen, let's do it. The alternative wasn't a good choice for me. And after meeting Dr. Zucker and Dr. Dalby, I felt very comfortable with them doing it, and I did a bunch of research on the procedure itself, and I honestly didn't have much hesitation.
So did you reflect at the time on the fact that you were going to be one of the pioneers for this? I mean, you know, not many, you could do research, but you couldn't talk to 100 people who had gone through this at the time. So you're really out there, you know, on your own.
Correct. I honestly didn't know that I was the first commercial patient. I knew that the study was done and it had gotten approved by the FDA in, I believe, July of 2025. And I really didn't know I was the first commercial patient, but I felt so comfortable with the doctors that I really wasn't that nervous about it.
All right, so no hesitation at all.
No.
Now let's go to the procedure itself. When did you have the procedure?
February 25th of 2026.
All right, so you have it. Describe, the doctors have talked about it, but it's going on, and what were you feeling as it was being done?
So Dr. Zucker put a halo on me. They put a helmet that has ice water running through it, I guess, to cool it down for the focused ultrasound. So I'm in the MRI machine for about 2.5 hours, 2 hours and 45 minutes, and I refer to it as zapping your brain. Then you can kind of feel you can kind of feel slight heat, no major pain, but then you can feel the heat, and they would roll you out every so many minutes and do a neuro check on you to make sure you could still talk.
And you're talking to these guys
Correct.
during this, right?
Correct.
You're talking to the doctors.
Oh yeah, yes.
Yeah.
And I kept being in the machine waiting for, you know, my mind's going crazy. Like I'm kind of feeling like I hope this is gonna work. That'll be my luck if it doesn't work. And I kept waiting for something to happen. And then finally I felt one zap that I've ever heard. It was probably number 5 or 6 in. And it was like they flipped the switch and my tremors were gone, like completely gone.
What? Okay, it's hard for us to even understand.
Right.
What was that moment like for you, in your heart, in your mind, to experience that?
I was obviously excited, and that was the first time, and from there on forward, that I felt peace in my body in 3 years.
I want to show people a picture of the successful patient, and I'm sure you've seen this picture, but if we could, I'm sorry, I'm told we don't have the photo, but it's you with the doctors, and I'll just describe it. You had the biggest smile on your face you could possibly imagine. But your celebration also is a celebration for Parkinson's patients all over the country and really all over the world. Does that ever enter your mind now?
Well, Dr. Zucker in his office has asked me a couple of times to speak to patients that are, I think, considering this procedure, and I'm more than happy to do that and be here just to bring attention to this, because listen, Parkinson stinks, and it's an awful disease, and it's hard to live with, and if other people can be helped by this procedure, then I'm happy to do this, and I hope that it will be.
Well, we're so happy that you're here and you could tell this story, Jan Homestead. Thank you so much.
You're welcome.
And congratulations.
Thank you.
We'll be right back. Thank you for making this part of your morning. As always, we encourage you to be part of the discussion each and every Sunday. We're always right here at 10 a.m. Until the next time, you can watch this morning's On the Record episode and every episode on our website, WPBF.com, and on our free WPBF 25 news app. I hope you have a wonderful Sunday. We'll see you again next week.